Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. You're trying to be healthy, you're eating right, watching your weight, working out on a regular basis, but there are some genetic conditions that a healthy lifestyle just may not protect you from. Our guest in studio today is Dr. Srihari Naidu, nationally recognized interventional cardiologist and director of the Hypertrophic Cardiomyopathy program at Westchester Medical Center in New York. Welcome to the program, Dr. Naidu.
Thank you very much for having me here.
Thank you for joining us today. Now, what is hypertrophic cardiomyopathy, or also known as HCM?
Sure. So hypertrophic cardiomyopathy is a relatively rare form of heart disease, but not totally rare. It's about 1 in 500 people, so it's far more common than we previously thought, and certainly more common than other diseases that people may have at the tip of their tongue, like multiple sclerosis, which is 1 in 700 people. It's instead of being a disease of the heart arteries, such as atherosclerosis or the heart conduction system that requires pacemakers, this is a disease of the muscle itself. The muscle gets abnormally thickened. And as it gets thickened, genetically programmed to do such, that happens over the course of a patient's lifetime, usually in their teenage years, in 20s, 30s, and 40s. When it's actually happening in their teenage and 20s years, they typically are at higher risk of certain types of arrhythmias. And if you think about it, every year we have, unfortunately, a few incidents where athletes have died suddenly on the field, typically basketball or soccer. If you look at their autopsies, unfortunately, this is the most common cause of death in that population. Now, most people make it past that, and they don't have that problem, thankfully, and then they go on leading lives where they just get worsening heart function, and they notice that as fatigue, shortness of breath, palpitations, dizziness, lightheadedness, and sometimes passing out. And this is really the heart muscle getting in the way of itself. It's not letting the blood circulate out of the heart because the heart is getting too thick. There's less and less room inside the heart now for blood to circulate, and the physical aspect of the thickening actually gets in the way of valves and gets in the way of the blood leaving the heart, and ultimately it's kind of the heart, kind of hurting itself in that way.
So is there anything that can be done to counteract some of these symptoms, or is it something, that is just going to happen genetically no matter what you do, whether you're a child athlete, an adult, or just going about your daily business?
Yeah, that's a great question. So, we don't want people feeling that they're not empowered at all here. There's no question that if you have it in your family, you get the genetic disease, you get the gene from one of your parents, and it's 50-50 inheritance. So if one of your parents has it, you have a 50-50 chance of your kids of each kid being affected. It will grow, and it'll be pre-programmed to grow to a certain extent. There are things you can do, though. There are certain medications that help alleviate the symptoms, and we are certainly looking for new medications. For 40 years now, we haven't had any dedicated medication for HCM, but thankfully we live in an era now where people are being much more precise. We call it precision medicine, where companies are now looking at how to target the individual actual problem for disease. One company looking at this is a company called Myocardia that has a new drug in development we're hoping will be targeted for HCM over the next few years. If those medications don't work very well, in about 10% of people, they go on to some major surgeries, which is a type of open heart surgery called septal myectomy. This can actually shave down the muscle. And then there's also a minimally invasive form called alcohol septal ablation that we do quite a bit here at Westchester Medical Center and are well known for that, which mimics surgery and tries to dissolve away or shrink away some of that muscle. But most people really need medications, and really the holy grail is to try to prevent this from getting to this level of thickening through medications or more precision medicine.
So just to be clear, all of the technology that you've been mentioning, the new drugs and things of that nature, we're talking about ongoing treatments, whether invasive, fully or less invasive, but there is still no cure. Are any of these developments, is their goal a cure from the onset, or are we still talking about treatment first?
Well, we're still talking about treatment. There's actually no cure for it right now. If you have the gene, that means it's in your DNA. You can't really get rid of that in your DNA. But these medications and these treatments can oftentimes modify the disease so that it's not so the heart is functioning better. There is some thought that some of the medications, if they work well in people, could they possibly prevent the disease from progressing? We're still a ways away from that, but that would be kind of the holy grail of this disease if we can find medications that can prevent that.
So when it comes to diagnosis on a DNA level, can you determine if someone is a candidate for this disorder early in life, or is it something that you have to wait for the symptoms and then determine genetically that they are predisposed?
So most people who come to our attention have some symptoms, and then that prompts a physical examination, which prompts an EKG and an echocardiogram, which is the way we diagnose it because it can look physically at the heart muscle. That being said, there is increasing amount of genetic testing being done. So if we have somebody with a very obvious case, we can then send them for genetic testing, which is simply a blood sample these days, and about 70 to 75% of the time we can find the gene that's running in their family. That then allows us to go back to find people in the family who have no significant thickening, but are at risk of it because they carry the gene. And so we are diagnosing people both ways. One is when they already have symptoms, when we try to get that earlier. And two is even before that, so that we can then really watch them more carefully, protect them, make sure they avoid the types of activities that might cause the sudden death, the types of athletics, for example, and then really follow them over time to see if they develop some of the heart failure symptoms and try to prevent that.
Are there any treatments that greatly diminish the drastic lifestyle change based on the heart's functioning, being so diminished? If you give, say, the athlete who you've identified as being a candidate for this, and you start treating him in such a way, is there anything that can allow him to continue being an athlete for at least some period of time, or is that a no-no once you identify the problem?
Yeah, I think, well, to answer your question in series, there are procedures and the medications, and mostly the procedures that can really improve the heart functioning, and so patients can go back to feeling great. And some of these patients feel like all of a sudden, I can go back to exercising out of proportion or to an aggressive level. The truth is, since all the muscle has the gene, that's still something that we don't want patients to do. Even if they start feeling better with the treatments or the medications, they are still at risk of sudden arrhythmia. So unfortunately, once you have the disease, those types of high levels of activities are out. That doesn't mean you can't be fit. It just means you probably can't play professional baseball or basketball or the equivalent of those types of activities. It does mean that you should stay fit so that your body is in as good a shape as possible to tolerate the heart dysfunction. That means catering your exercise routine in conjunction with a cardiologist or an HCM specialist so that you stay fit but don't tax your heart too much.
Well, we're talking DNA, so that suggests families. Now, this being a family type of a disease, when it comes to help and education and support, what is available for something that, is 1 in 500 people, such as this disease?
Yeah, so for families, the best thing would be these national advocacy groups. There's a wonderful one in New Jersey called the Hypertrophic Cardiomyopathy Association. They've been around for over 20 years. The founder is a patient, and they can be reached at www.4hcm.org. We do allow and would be happy to take care of any patients here at Westchester, even if it's via email. We have a dedicated HCM email, which is hcmprogram@wmchealth.org, and we're happy to answer any questions and just be a resource for people even at their local areas. And finally, one thing that came out last week, actually, at the American College of Cardiology annual meeting is a specific iPhone app called HCM Care. That's a free app that can be downloaded. It was put together by some of our friends at Duke University Medical Center with the HCM program there. And that has a lot of resources on there, as well as links to all kinds of other educational venues.
Great. Well, I appreciate you talking with us today, Doctor.
My pleasure. Happy to.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Hari Naidu. He's a nationally recognized interventional cardiologist, and we've been talking about hypertrophic cardiomyopathy and the program that he heads at Westchester Medical Center in New York City. Transcripts and audio of this program are available at hpr.fm and also at healthprofessionalradio.com.au. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.